We're at the Community Health Center of Branch County. We're in the radiology department. We've got Dee Daly with us. She is the director, and some new things going on. We're all digital now.
Yes,
Tell me
we
about
are.
this digital age.
We, in the last 5 years, developed a plan to completely modify, add state-of-the-art equipment to this department. And we started with CT, and we have just finished with digital mammography. We're very excited. What that's allowed us to do is to bring state-of-the-art equipment to this department, to the community. We have got skilled, qualified staff, excellent radiologists, and great equipment. So we're very excited.
Well, digital, I mean, everybody looks at digital TV, and you look at digital clocks and digital everything. Well, what's the advantage when it comes to the radiology?
With digital imaging, it reduces time, so it saves time for the patient.
Okay.
They're not here nearly as long as they
We
would
like
have been
that.
in the
We
past.
like
That's
that.
correct. It allows the radiologist to see the images at a much quicker time, which turns the report or the turnaround time to less time.
Okay.
It allows the radiologist to see the images from his home. It allows our referring physicians to see the images from their offices, from their home. It allows us to send images to other facilities that may be taking care of the patients once they've left our facility. It just greatly improves their care.
Well, really, it sounds like speed is what happens when you're reading it. I mean, again, digital, it's all happening right now. They've got the images. It sounds like it's clearer.
It is.
For them, so it makes it much easier. And, you know, it's kind of that technology-based imaging where everybody can see it all at once. You know, in this world of interconnectivity with the internet, so that's kind of what we're looking at here, is that everybody can look at the same type of images at once.
That's correct. All of our images are stored in what we call a PAC system, which is Picture Archiving Communication System. It is a web-based product. So what that allows is for what you just mentioned. The radiologist can be looking at the images. The referring physician can be looking at the images. They can confer, talk on the phone, figure out what is going to be the best or the next course of action for their patients. And what it also allows is because it improves image quality, the radiologist can lighten, they can darken, they can zoom in, they can zoom out, they can actually magnify and focus on areas of concern, which once again improves the image quality and the result for the patients.
So tell me about where you can, the images where you're doing it in real time. What's that mean?
If we have a patient that maybe they're having difficulties with their stomach, and their physician feels that maybe their stomach isn't working properly and they just want to see how it works as the patient is eating or drinking something, that is called fluoroscopy. It would be an upper GI. The patient would come in, we would have them drink what we call barium, or it could also be called contrast. The radiologist is in the room with the patient along with the technologist, and they're actually taking a video of the patient as they drink the barium, as it goes through the esophagus, into the stomach, as it empties into the colon, and it's just one of the methods that we have within this department to image inside the body and actually see what's happening for the patient.
This is all new stuff then, so that, again, as you're talking about seeing it, you know, that patient with stomach problem, they're not going to have to wait. They're going to know right then probably what's going on.
Yeah, well, the report will be issued to their physician, and yes, they will know very quickly. That's not a new thing for the radiology imaging world, but it is just one of the areas within the department that we can take care of the patient. We can do general x-rays, which would mean a chest x-ray or maybe an x-ray of your hand. We, of course, have MRI, magnetic resonance imaging, which uses a strong magnetic field to image inside the body. CAT scan, we've got mammography, we have nuclear medicine, we have ultrasound, many different things within this department that we can utilize.
Now, one of the things that you told me too is that what a great staff that you have here. And that's what you said. You know, it just really makes it fun because we have, you know, great qualified technicians. We've got good people, good personalities. It just makes it a great place to work then, doesn't it?
One of our goals in this department is to make sure that when patients come to see us, they feel comfortable, they feel confident that we are going to take the best possible care that we can for them. They're going to get the best customer service possible, and they're going to want to be able to come back and see us again in the future if they need to. Without qualified staff, registered, qualified, skilled technologists, I wouldn't be able to offer that to the patients, and I wouldn't be able to run this department without them.
Well, it sounds like you got a great department, great technology, great back end when you've got the doctor and the radiologist reading everything. So it sounds like just a great place to get an x-ray.
Well, you know, I think so.
I feel like my arm hurts right now.
I can help you out.
You can help my leg too. You can, my stomach. I can get an x-ray. I'll know what's wrong with me, right?
That's right.
Well, Dee, it's been a pleasure visiting with you. Is there anything else about the department or things that have been upgraded? Again, this is kind of the final phase of the 5-year plan, isn't it?
It is, and we're very excited. The most recent was the digital mammography, and what we found so far with that modality is that patients in the past, they would come in, they could be anywhere from 30, 40 minutes by the time we've done their procedure, we've looked at their images, made sure everything is okay. They're finished within 10, 15 minutes now. And I think that they're realizing that the changes in the technology now are designed to help them. We live in a very fast-paced world, and if we can produce quality images, deliver great results, and get the patients the results that they're looking for, then I think we're doing our job.
All right, good deal. Thanks for being with us.
All right, thank you so much.
Dee Daly, she is the Director of Radiology here at the Community Health Center of Branch County. We've got more coming up. Stay with us. You're watching Q1 Video Network.